Vitamin D deficiency is actually something that's been implicated in a number of different diseases. And it is one of those conditions that without checking, we don't really know whether we're vitamin D deficient. Unfortunately, it's also significantly more common than people realize. There's many different functions played by vitamin D. It's involved in bone and mineral metabolism, but it's actually also involved in immune function. So during a time like this, when there's COVID-19 pandemic happening, you definitely want to make sure your immune system is optimized the best that it can be. And vitamin and mineral deficiency are a big part of optimizing your immune system functions. Vitamin D is actually comes from many different sources. The first source is dietary vitamin D. So we need to make sure that we're enriching our diet with vitamin D with things like calcium and yogurt. The other source of vitamin D is actually vitamin D that our body makes. It's actually made and released from the kidneys, and then it's activated through the sunlight. Now, of course, if you go out in the sun, you want to be sure to wear sun protection because you want to, reduce your risk of skin cancer. So keep that in mind as well, as those are competing priorities. Vitamin D, it can also be found in supplements. Be sure to talk about the dose with your doctor. So typical dose should be about 1,000 IU every day. I've often seen people take 5,000 IUs a day, or even some people take 50,000 IUs a day. And too much vitamin D can actually be toxic. So you don't want to over supplement your vitamin D.